Kelly Spitz, and Tracy Nauer is Director of Akron General Visiting Nurse Service Hospice and Palliative Care. And she's here to talk about hospice and the services provided. Welcome. Thank you so much for joining me. First, give me an overview of what is hospice care.
Well, hospice care is really a philosophy of care that focuses on quality of life, not necessarily quantity of life. We really focus on the patient and the family unit as a whole and their physical, mental, spiritual, and psychosocial well-being.
So who can receive hospice care?
Really anyone can receive hospice care who's facing a life-limiting illness and their life expectancy is 6 months or less.
So what's the difference between hospice and palliative?
Well, hospice really incorporates the palliative philosophy, which is pain and symptom management. But to qualify for hospice, you have to have that life expectancy of 6 months or less. To receive palliative services, you can have a greater life expectancy and still be seeking curative treatments.
So where is hospice care provided?
It's provided anywhere the patient calls home. It could be their independent residence, assisted living, nursing home, group home, anywhere they call home.
What's the most important point that you would want individuals to remember about hospice and hospice care?
Well, I think the important part about hospice is having the conversations with your family or your loved ones about what your wishes would be should you be facing a life-limiting illness. A lot of times our families are faced with choices to make for their loved ones when they can't speak for themselves, and that really puts the family in a hard situation.
So really the hospice care too is also for the caregiver and the family.
Absolutely.
And you're there afterwards as well, correct?
Absolutely. Our bereavement specialists follow our families for as long as they need to, up to about 2 years after the death of their loved one.
Thank you so much. I appreciate the information.
Thank you.
If you would like more info, call 330-665-1455 or log on to vnsa.com.